Hi there. Today we'll be talking about kidney stones. Did you know that over half a million people visit emergency rooms every year due to kidney stones? About 1 in 10 people will experience one in their lifetime. Let's dive into what kidney stones are, why they form, and how to prevent them. Kidney stones are hard deposits of minerals and salts that form when urine becomes too concentrated. This allows crystals to form and stick together. Symptoms include severe pain in the back, side, or lower abdomen, along with nausea, fever, chills, and sometimes blood in the urine. Dehydration is a major cause. Without enough water, urine becomes overly concentrated. High salt or oxalate rich diets and certain health conditions can also increase the risk. There are four main types of kidney stones: calcium oxalate stones, uric acid stones, struvite stones, and cystine stones. Understanding the type of stone can help guide the treatment and prevention. Small stones may pass naturally with water and pain relief. Larger stones might require shockwave lithotripsy, a non invasive procedure using high energy sound waves to break stones into smaller pieces. Surgery for large or complex stones. Preventing kidney stones is simple. Stay hydrated. Consult your doctor if you're on fluid restrictions. Reduce salt and oxalate rich foods like spinach. Balance your diet with calcium rich options. Small lifestyle changes today can prevent big pain tomorrow. Take care of your kidneys, and they'll take care of you.